Hello and welcome to Prairie Pulse. Coming up a little bit later in the show, we'll meet the 2021 North Dakota Poetry Out Loud champion. But first, joining me now is Sanford's Chief Medical Officer, Dr. Doug Griffin. Dr. Griffin, thanks so much for joining us today.
Yeah, you're welcome.
As we get started, tell the folks a little bit about yourself and your background, maybe where you're originally from.
Yeah, I'm a family physician, originally from Minnesota area, in the Twin Cities. Long-time practice in Alexandria, Minnesota, and then I've been up here in this role for about 5.5 years now in Fargo. Married a Moorhead gal, so we've known this area for a long time.
Well, okay, we're here today to talk about COVID again, as you did last time you were here. And, you know, numbers seem to be dropping dramatically, and vaccination rates are still on the rise, although slower now. Can you give us sort of an update on the COVID situation?
Yeah, it's continuing to look better. We are basically at the lowest number of cases for approaching a year now, going back to last summer, and steadily falling in our state, neighboring states, and across the country. So that's good. Still have patients hospitalized with COVID, but far fewer than we had before. So it's looking much better.
Well, and I think I saw, was it Britain or whatever, had 0 deaths for the first time, just in the paper recently. But why do you believe the number of people for vaccination has dropped, though? Is it people who want a shot have gotten a vaccination, or what?
Yeah, I think it's kind of expected. So a couple of things. First of all, there was a heavy demand for vaccine when it first came out. And then so people that wanted to get the vaccine, needed to get the vaccine, really, stepped up. And we were able to ramp the supply up across the country to meet that demand. And we really have met that demand of those people that were eager to get the vaccine. We still have a significant number of people trickling in. They were waiting for some reason, and then it has expanded recently to a younger age group has done that. But we're still vaccinating 1,600 people a week, so it's still some demand.
Percentages have been talked about. What percentage of the public being vaccinated are you comfortable with?
Well, that's a good question. The higher the better. I think would gives us more margin, more protection. So, I'd love to see 100% of anybody that could get the vaccine, and appropriate for them to get the vaccine. Realistically, I'd be quite excited if we reach 75 to 80%. That would be a tremendous vaccine effort.
Yeah, you mentioned, of course, younger people. I understand the vaccine's now available for 12 and older. So that 12 to 15 is opened up. Can you tell us, how is that going?
That's going pretty good. I mentioned about the 1,500 or so people we're vaccinating each week. 30 to 40% of those in that minor age group. So it's going. I think schools ended in West Fargo, ending soon in the other districts in the area, and I think that's brought up some uptick as well too. So it's going good. We're seeing that being steady. We're giving it also across a number of our clinics, including the pediatrics clinics. So it's going well.
Well, but are there some parents hesitant to bring young children in, and if so, why? And I mean, my guess is they're still not comfortable with the vaccine being produced so quickly.
Yeah, one of the things that we deal with a lot, and particularly in the pediatric patient population, is hesitancy on vaccine. We do a lot of vaccine for children and school children, starting from shortly after they're born. And parents, very appropriately so, have questions, good questions, and want to know, what the risks of the vaccine and what the benefits of the vaccine are. So this is expected, very appropriate for parents and family and these older children to ask the question. So I think people are just weighing the information that they're getting. So So we anticipated that we would have some parents hesitant and cautious, and that's very, very appropriate. We think it's a very safe vaccine. We think it's very appropriate and encouraging to get children vaccinated. But we understand that some parents need some time to process this, and our professionals are eager to and happy to have those conversations with them.
Yeah. When do you predict that the vaccine would be available for children under 12?
Yeah, I think probably be late this year, fall to late this year. We might see expanding down to that 5 to 11 age group, and probably not until 2022 if my crystal ball is okay for the even younger set than that. So.
Mm-hmm. Well, what about, many of the younger adults? Young adults are foregoing, I guess, the vaccine. Is that because, as young adults, even when I was young, you think we're sort of bulletproof, we don't need vaccines, or is that potentially a bad situation in your opinion?
Yeah, there's a little bit of an air of invincibility in that age group. You and I apparently both had that, and that's also normal. And it's borne out a little bit in the data. The young adults, many that got COVID, were not very ill. They were not the ones likely to get hospitalized. However, I can certainly point to some very critically ill young people, and also I think we need to think about it as a public health thing. So a young person can transmit the vaccine to somebody much more susceptible. So I think that is really part of the encouragement we need to give them. Mm-hmm. Not totally invincible, and they can pass it to somebody that's higher risk.
Well, and with that said, I mentioned how quickly the vaccine was produced, and was that a miracle of sorts, or was it just our technology? We're at that level now, or?
Yeah, I think it's more the latter. I don't think it was a miracle. There was a lot of red tape that was cut. The FDA, CDC really rose us to the top of all the things that do that. A few things. We had actually some scientific laboratories that are already working on vaccines for coronaviruses, other coronaviruses, and they were able to piggyback that into that. An unprecedented amount of funding was thrown into this as well. I don't think there were corners cut. It was just some of the red tape was cut, and they got to approval process much quicker. But it was really an unprecedented effort. It wasn't a miracle. It was just a huge lift and a lot of work.
So is the United States the leader in vaccines? I mean, I think I saw a report recently that we were close to 60%, and yet Japan was 8% or somewhere much
We're
lower.
among the leaders in the country. Other than China, no other country has given as many vaccines as we have. We're approaching 300 million vaccines given, but we're a very large country. There are a few countries, for example, Israel and a few European countries that have a higher percentage of patients vaccinated, but you're right, there is some definite discrepancies across the world. In some countries, very low vaccine rates at this point in time, but the United States, we're in a good position and have enough vaccine and continue to work on convincing more people to get vaccinated.
Well, are we even, I understand, well, what I've read, we're actually shipping vaccines to other countries.
I understand we are going to share doses of vaccine. I think the last number I heard is close to 60 million doses shared with other countries. I anticipate that'll probably be more as time goes.
Well, were you comfortable with the CDC guidelines that recently came out where vaccinated people really don't need to wear a mask inside or outside?
Yeah, that was, it came actually kind of quick. It was rather quick, and it did catch me a little bit by surprise. To answer your question, I am comfortable with, because as I said, we've been vaccinating about 300 million people close to the country and have had very little breakthrough of patients that have had the vaccine getting COVID, and even fewer of those getting very serious ill. So I think we have good evidence that the vaccine has worked, and we have confidence in the science, and I think that's what really drove the decision. The awkward thing about the decision, as you know, is there's no. In some states, there are some people are asking for vaccine status, but it's really a bit on the honor system. I was in a grocery store the other day, and it was appropriately signed. Now, if you're vaccinated, you do not have to wear a mask, or CDC guidance. I went in unmasked, and I was about the only one in the store not wearing a mask. And then my wife, at the same time, was in another establishment, and nobody was masked. She's vaccinated as well. And so I'm thinking, I don't think it's likely that 100% of the people in the grocery store weren't vaccinated, or equally as likely that 100% of the people in the other establishment were vaccinated. But so that's kind of the awkward time we're in. But I'm comfortable with the science that helped guide that decision.
Yeah. What are the policies in Sanford's facilities right now?
Yeah, healthcare facilities have not really changed. So we're asked people to mask when they come in. You'll see the caregivers masking with patient contact. We have a few, if you're vaccinated, get in an exam room or visiting, you can go unmasked a little bit, but for the most part, it has not changed. That continues to be the CDC guidance.
Well, and the question I'd ask is, with your crystal ball, do you have any thought of when that might change?
I don't. We haven't really had much evidence or indication on that. But I think if we get to a sustained period of low community transmittability, I think that's where you might see some modification in that. So,
you mentioned other countries. You talked a little bit about it in India. I mentioned Japan. How concerned are you that COVID may not be under control in some of those areas?
Yeah, that remains a concern, and I think the evidence bears out that they have struggled a bit with the vaccine and some of the other guidelines, and real shows that still I think the virus can take hold and cause significant illness.
Mm-hmm. People are starting to get out now. They're starting to travel. Do you believe air travel is relatively safe, especially if one's vaccinated?
Yeah, I'd feel more comfortable about it. I think the CDC still requires, or the government still requires, masks during air travel. I'm not 100% on that, but and interstate travel. So I think it is. I would feel more comfortable about it being with your vaccinated and a vaccinated person. Yeah.
As people still take the vaccine, I know my son recently got vaccinated and was asked which one he wanted. He was given a choice. Of course, he didn't have a good answer. He just said, whatever you think. What about the side effects or effectiveness of the three, Pfizer, Moderna, and Johnson & Johnson?
I've just read a commentary on this, and I have to say I agree with that. Early on, when I think always the answer was take the vaccine that you're offered. I still think that's a reasonable answer, but now we have given a lot more vaccines. We've given a lot more of the messenger RNA vaccines, Pfizer and Moderna, than we have Johnson & Johnson, just because they came on the market more and there's earlier and a little bit more of a supply. To be honest, if somebody was asking me, my children who are all actually vaccinated, I think I would choose a messenger RNA vaccine, one of the Pfizer or the Moderna. Not that the Johnson & Johnson is bad, but perhaps a little less efficacy. That one odd, although very, very rare condition. But I think they're still all good vaccines, but I think there is a little bit of consensus among some experts that perhaps Pfizer and Moderna kind of stand just a little bit above Johnson & Johnson.
And the concern, was that the blood clotting that you were talking about?
But again, an extremely rare condition.
One in a million, I think.
Yeah, rare condition, and I don't think that should be a big factor. But if we're going to weigh things.
Yeah. Well, what about vaccinations? Where can people go get vaccinated, and do they need an appointment, or is it just walk up and walk in?
Yep, we still have and anticipate at least into July having our vaccination center open at Gordman's. Our days there are Tuesday and Thursday full days and half day on Friday. You can either make appointment online visiting our website, or you can just walk in. Also, we're giving it, and actually by the end of this month, pretty much all of our clinics throughout the city will have vaccines available. Again, you can schedule an appointment, and they can accommodate some walk-ins as well. Or if you're there, which is the nice thing about having them for clinics, if you're there for another appointment and you say, hey, could I get the COVID vaccine, we can happily accommodate that.
What about people who need to or want to get tested? Can they do that at that site, or do they have to go somewhere else?
Yep. If you are, you can get tested at any of our primary care or walk-in locations. We can collect tests. And actually, for people that are concerned about symptoms, we have some rapid test available. It's appropriate for them. And still at our South University urgent care site, that's where we've closed the drive-through testing. But if people just need to be tested, if they were in contact or travel, they can just walk in there and get tested.
You mentioned you're going in the grocery store and your wife going in another, but as you walk around Fargo, and obviously people seem to be getting outside more. They seems like they're ready to do things.
Absolutely.
You hear concerts are being announced again, outdoors and things. How do you see us moving forward and getting back to what I'll call a more normal situation?
Yeah, it's I think it was a little bumpy when we kind of backed off on things. I think it'll be a little bumpy as we go. I think people are starting to dip their toe in the water. Some are, jumping in, and I think people will become more comfortable with things as it goes on. But I think the difference, we all remember last fall when things really took an upturn. I think the difference this year is the vaccination. So we have many people vaccinated. We'll continue to get more vaccinated. And I think that gives me confidence that as we get into more norm, masks are off, more gatherings are occurring, that I'm comfortable that'll happen. It's been a long time coming. So
yeah. So what's your message for people that are hesitant still to get the vaccine? I mean, realistically, there are certain people that will not take a vaccine for their own beliefs or whatever.
Yep.
But what about people who want to take a vaccine, but they're hesitant and worried about it?
Yeah, I think at this point in time, and I understand that too, but now we have moved on 300 million people and growing every day vaccinated, continuing to demonstrate very strong efficacy. And more importantly, I think what people are most concerned about is the safety about that, of the vaccines. These really are looking very strong, very, very safe to do that. So we understand people being cautious. That's absolutely appropriate, but I think they can feel more comfortable. But if they have questions, discuss it with your physician or clinician. I'd say more than 90% of our physicians have been vaccinated. I think that speaks strongly of that, and their families are being vaccinated. So, but I trust a healthcare clinician that can give you some good, honest discussion about it. But don't be embarrassed if you have questions and hesitant. I think that's absolutely fine. But get good information and have the discussion with your doctor.
Real quick, what are you hearing about the need for a booster or not?
Yeah, I think there are a few companies working on a booster. I think it's to be determined yet. I think if we need a booster, it might be to cover additional variants. So that's why I don't think it's been determined yet if we'll need a booster. But I think we'll know more in the next, probably yet this year.
Yeah, I wish we had more time. We'd talk about variants, but if people want more information, where can they go?
Yeah, I think several good sites. The State Department of Health, our website, CDC website, all very good. There are many good sites to visit to get information.
All right, Dr. Griffin, thanks so much for joining us today. Stay tuned for more. Poetry Out Loud is a high school program that encourages students to learn about poetry, master public speaking skills, and build self-confidence. Kylie Howitt from Northern Cass High School was the 2021 North Dakota Poetry Out Loud champion.
The soft-toned clock upon the stair chimed 3. Too sweet for sleep, too early yet to rise. In restful peace, I lay with half-closed eyes, watching the tender hours go dreamily. I am interested in poetry because it offers me another outlet to perform. At Northern Cass, Poetry Out Loud is required.
So we use it in our English classes, 9 through 12, to help develop their skills, not only interpreting poetry, but then reading it expressively.
The fact that you can give the same poem to 5 different people and they'll interpret it differently, I really like that aspect.
The information materials are provided by the North Dakota Council on the Arts. It's a national program. And Poetry Out Loud turns it into a competition.
Congratulations to Kylie Howitt from Northern Cass High School.
There's of course a winner at every level. There's a winner at the state level, there's a winner at the national level.
And so we have classroom competitions, and then they compete at the school level, usually about 10 to 12 kids from different grades. And the winner of that goes on to the state competition. And at the state competition, they have 3 poems that they'll recite.
So the requirements for the state level of Poetry Out Loud is you have to have at least 1 poem that's 25 lines or fewer, and at least 1 poem that is pre-20th century.
This year they had to film them beforehand, and then we sent it in, and so they competed virtually.
Last year I did go to the state competition and performed in front of people, and that was a much more intense experience. People are there because they really do love poetry, and they're there to listen and to hear everything. When I first read The Barnacle by A.E. Stallings, I loved it. It was perfect. It was everything that I was feeling about the world, especially at that time, because it's about how stubborn people are, and once they're in one mindset, they're only in that mindset, and they will never change ever. Once grown, with nothing more to prove, it hunkers down and will remain stuck fast, and once it does not move, has no more purpose for a brain.
Yeah, Poetry Out Loud, they provide a website with a huge library of possibilities.
Choosing poems isn't really about who the poet is. It's just about what the poem is about.
Once they start reading the poetry, they start to see pieces of their life in the poem.
My last poem, Dream Song 14, I encountered a few years ago. My brother was looking for poems for Poetry Out Loud, and he found this poem, and he came to me and was like, "You have to read this poem. It's so hilarious." There's a line in the poem that my mom basically paraphrases a lot. What she says is, "Boring people get bored." And in the poem, it's, if you have no inner resources, you're gonna get bored, basically.
We spend quite a lot of time going through the poems and interpreting and really understanding them. And then once we get to the competition level, it's almost a challenge for them to memorize this. And so we start with just memorize it and just say them, and then you slowly start adding phrasing and pauses and just give a little bit of flavor to it.
Dawn by Ella Higginson is really an appreciation for nature. It's such a peaceful poem to me that I felt like it was a really good contrast, especially to The Barnacle. The chanticleer sent drowsy calls across the slumberous air. In solemn silence, sweet it was to hear my own heart beat. When I'm presenting my 3 poems, they each have a very distinct emotion to them, and I really try to personify that in my voice and just in my expressions. The only action that I do in any of my poems really is in the barnacle, when it becomes stuck fast and it doesn't move. A lot of times with poetry, the voice is all that is really needed. And if you add a lot of actions, it takes away from what you're saying and it just makes it a little muddy. Dream Song 14 by John Berryman. Life, friends, is boring. We must not say so. After all, the sky flashes, the great sea yearns. We ourselves flash and yearn, and moreover, my mother told me as a boy, repeatingly, ever to confess you're bored means you have no inner resources. I conclude now I have no inner resources because I am heavy bored. Peoples bore me. Literature bores me, especially great literature. Henry bores me with his plights and gripes as bad as Achilles, who loves people and valiant art, which bores me. And the tranquil hills and gin look like a drag, and somehow a dog has taken itself and its tail considerably away into mountains or sea or sky, leaving behind me. Wag.
Well, that's all we have this week on Prairie Pulse. And as always, thanks for watching.
Funded by the North Dakota Council on the Arts and by the members of Prairie Public.